Hi, this is Denise Bowens with CSG University. I'm here with Dr. Adam Sackstein, Medical Director of the Pain Management Center. Welcome, Dr. Sackstein.
Thank you.
What is complex regional pain syndrome?
So complex regional pain syndrome is actually a type of nerve pain, and it's been around a long time. It used to be called RSD. There's actually cave drawings that have been discovered of people with what appears to be this problem, but it's only recently, last several decades, that it's been recognized as a real disease entity. And about 10 years or so ago, they changed the name from RSD, which stands for reflex sympathetic dystrophy, to CRPS, which stands for complex regional pain syndrome, and that was because the exact role of the sympathetic nervous system is not terribly well understood, but it is ultimately a type of nerve pain that patients get after sometimes even a trivial injury, like a paper cut or something like that, but also can occur after a traumatic injury like a broken bone or even after a surgery.
Great. Now, what are some of the treatment options for these patients?
So the treatment of CRPS is usually multifocal. There are physical therapy and medications are part of the mainline treatment, but it also involves more interventional things, which is the focus of what I do. There are nerve blocks that are done for this to try to break the cycle of pain, either at the sympathetic chain or more centrally in the epidural space. And if nothing else is successful, we will sometimes implant a device called a spinal cord stimulator.
Can you tell us a little bit about that and how it's used?
Sure. Spinal cord stimulation works on the principle that all nerve transmission is fundamentally electrical, and much like when you take your electronic device near an electric field, you get static. Spinal cord stimulation works by generating an electric field that crosses across the pathway that the pain impulses travel up the spinal cord. And when those impulses travel through that region, they get scrambled. And so instead of feeling pain, the patients feel a tingling sensation that the vast majority of people find pleasant. So the idea is to scramble that signal and create this pleasant tingling sensation in the areas where the patient has their pain.
And what patients is this appropriate for?
So spinal cord stimulation has actually become more and more prevalent as the technology has improved. Like most things, the technology gets better, it gets more programmable, the equipment gets smaller, and the uses have actually expanded somewhat over the years. It's used for these types of patients, for the CRPS patients, but we also use it in failed back surgery patients who've continued to have neck and back pain or extremity pain from that. It's used, can be used in patients who have phantom limb pain. There are actually indications for which it's rarely used, like intractable angina and intractable vascular disease, because one of the things spinal cord stimulation does is it increases blood flow. Now, I don't know anyone who's ever actually put one in a patient who's having intractable chest pain, but it is actually an indication for the treatment.
Fantastic. Thank you very much, Doctor, and we'll see you next time at Spotlight On.
Thank you.